Estamos dando un par de minutos para que...
Good morning with everyone. We are just going a couple of minutes so everyone can connect, and we will begin right after those 2 minutes. Thank you.
Creo que estamos listos. Entonces, queremos agradecerles mucho. Muy buenos días desde la Organización Panamericana de la Salud. Queremos agradecerles mucho su participación en el webinario del día de hoy sobre vías seguras para peatones y ciclistas en Latinoamérica y el Caribe, que se da dentro de la 8ª Semana Mundial de las Naciones Unidas para la Seguridad Vial. Yo soy Ignacio Ibarra, el asesor regional de legislación relacionada con la salud, y tendré el gusto de guiar las actividades del día de hoy. Para OPS es bien importante este tipo de actividades porque lo que buscamos es generar estas vías seguras para los peatones y los ciclistas en todo el continente. Y bueno, esta actividad ofrece una oportunidad clave para impulsar la acción a nivel nacional y local, visibilizando los desplazamientos a pie y en bicicleta. Cuando estos son seguros, se convierte en una parte integral de la consecución de la década de acción para la seguridad vial, que termina en el año 2030 y contribuyen al logro de los diversos objetivos de desarrollo sostenible, como lo es la lucha contra la pobreza, la salud y el bienestar, la educación, el crecimiento económico, la mejora de infraestructura, la reducción de desigualdades y la creación de ciudades sostenibles y la acción frente al cambio climático. Vamos a empezar con un mensaje de nuestro director, el director de la Organización Panamericana de la Salud, y que también es el director de la Oficina Regional para las Américas de la Organización Mundial de la Salud, el doctor Jarbas Barbosa. Por favor, Katiushka.
Me complace sumar-me à la comunidade mundial para comemorar a 8ª Semana Mundial de las Naciones Unidas para la Seguridad Vial e promover a segurança de peatones e ciclistas. Caminhar e andar em bicicleta são excelentes meios de transporte e contribuem à saúde e ao bem-estar e às cidades mais sustentáveis. Ajudam a prevenir enfermidades não
They help
transmissíveis.
to prevent non-transmittable illnesses and also in reference to being able to improve the general quality of health. Although road safety has improved in the region of the Americas, it is important to be able to adopt in other countries policies that are able to promote the safety of pedestrians and cyclists. Today, it's 9 countries of the region that have these, which means that unfortunately, the we are seeing that this is not safe, especially for pedestrians and cyclists. And also, 1 out of each 5 deaths caused by traffic in the region correspond to pedestrians and cyclists. However, there are cost-effective measures based on evidence to make it safer to walk and use bicycles. For example, design of safe streets with specific ways for pedestrians and cyclists, safe vehicles with advanced technology with emergency brake systems, areas that have maximum speeds of 30 kilometers per hour or 20 miles per hour in urban areas, and also in strict application of law, behavior applying laws that de-incentivate to drive vehicles at a high speed under the influence of substances or in a distracted manner. Attention to emergencies to be able to save lives, and considering that when there are collisions, the people are able to get the assistance they need in the best quality possible. The World Health for Road Safety is a valuable opportunity so that countries are able to act with concrete measures on a local, international, and regional manner we will be able to create cities and communities that prioritize this and where people can walk and ride bicycles without any danger. It is time to be able to adopt the means of transportation that are healthier and more sustainable and eco-friendly. We have the tools and these solutions to be able to do this. Now, we should be able to have the commitment of being able to get that everyone, everywhere, is able to walk and ride bicycles without any danger. We thank our director very much for his words and apologies. And just to remind you that we do have interpretation, translation, interpretation to English or Spanish. You simply need to go to the bottom of the Zoom. We have a world icon, and you can choose the language of your preference.
We have simultaneous translation for people that need to hear it in English. So please just go to the bottom of the Zoom monitor and you can switch the language of your preference. A continuación, tenemos
Now we have the opening words of Dr. Silvana Luciani, that is the head of the Unity of Non-Communicable Diseases and Mental Health of the Pan American Health Organization in its main headquarters in Washington. Silvana, go ahead, please. Thank you very much, Ignacio. Thank you very much to each and every one of my colleagues, over 200 people from all of the countries in Latin America and the Caribbean. I'm going to speak in English. So if you please need interpretation, like Ignacio has mentioned, we have simultaneous interpretation, and you just need to press the button where it says interpretation, and you would just choose Spanish.
Distinguished colleagues, we have members of parliament, representatives from governments and civil society organizations, and welcome to this PAHO webinar on safe roads for walking and cycling in Latin America and the Caribbean in commemoration of our 8th UN Road Safety Week. We're so delighted to be able to have this webinar together with our colleagues in the Road Safety Parliamentary Network for the Americas, as well as the Global Alliance of NGOs for Road Safety, and of course with our colleagues in the World Health Organization who are also joining us today while celebrating at the global level the UN Road Safety Week. As most of you know who are working in the area of road safety, this commemoration began in 2008, many years ago, to promote this concept of multi-sectoral collaboration. And from our perspective of the health sector, we see a clear and very strong role in the promotion and prevention of road traffic crashes, but also in the emergency care response and strengthening that emergency care response for road safety, for road traffic crashes and to promote road safety. And this year, the 8th of the celebration of Road Safety Week, we're really happy to focus on active mobility. That is to really advance on those road safety policies as well as physical activity and health promoting environment policies that ensure that people can walk and cycle in their place, in their cities, in their communities, in a very safe modality. And this, we all know, helps improve physical activity, connection to the community, to mental health. And we know that it reduces road safety, it promotes road safety and reduces road safety crashes as well when we use alternative sources and healthier sources of mobility. We know physical activity reduces the risks of cardiovascular disease, diabetes, major cancer types, as well as reduces risks for depression and Alzheimer's disease. And that's why walking and cycling promotion and physical activity promotion are really central to PAHO's work in road safety, which is aligned with the global plan for the Decade of Action on Road Safety, which goes to 2030. And the global plan and our work at PAHO really promotes this multimodal transport system and safe system approach to promote the use of motorized and non-motorized transport systems and ensure that they are safe, affordable, accessible, and sustainable for all. And that's the spirit and the topic in which we want to promote our discussion today in this webinar. But we also want to highlight that unfortunately active mobility remains unsafe in many, many parts of our region throughout Latin America and the Caribbean. So we know that each year over 145,000 people die due to road traffic crashes. And 1 in 5 of these people who die in road traffic crashes are either pedestrians or cyclists. And we also know that many policies that can promote safe walking or safe cycling are still missing in most countries in the region. For example, only 10 countries have, of the 35 in the Americas region, have policies that actively promote safe walking. Only 13 promote safe cycling. And countries that promote both safe cycling and safe walking through their policies, there's only 9 of those countries. But what's even more concerning is that very few roads, I'll say the infrastructure that exists in our countries, very few of them meet that minimum 3-star safety rating or higher. So only 21% of the roads for pedestrians and only 23% of roads for cyclists are considered safe or meeting those safety standards. So all of this calls the need and the urgent need for attention to put safety at the core of our work on mobility and physical activity promotion and road safety promotion to make sure that no person suffers from fatal or non-fatal road traffic injuries while walking or cycling. The good news is that we have cost-effective interventions through policies, legislation, regulation, changes in behavior of drivers, cyclists, pedestrians, and that we know that the investments in safe walking and cycling and in infrastructure support for that really have proven benefits. We know that vibrant communities are created by creating those bike lanes or those safe walking areas. We can increase retail sales because there's more pedestrian activity. It improves property value. It leads to higher public transport use and benefits local economies. So the benefits are endless to promoting safe walking and safe cycling while promoting road safety. And we have many, many examples in Latin America and the Caribbean on what countries are doing to promote safe walking and cycling. And some of these you'll hear about in today's webinar to illustrate that it is feasible to promote active mobility using the safe system approach that PAHO is promoting. So once again, thank you everybody for joining us and participating in this webinar. And I really hope that you learned something new that helps contribute to the work that you're doing during this second decade of action for road safety. So thank you very much, and back to you, Ignacio.
Muchas gracias, Silvana. Y bueno, quisiéramos ahora dar
Thank you
paso.
very much. Thank you very much. Now we would like to give the floor to the intervention of Dr. Nan Tran, who is responsible of the Unit of Safety and Mobility of the World Health Organization from Geneva. Go ahead with you. We give you the floor.
Colleagues, I will also be speaking in English. So a very good morning, afternoon, and evening to everyone. It is also my great pleasure to welcome you all to the seminar in celebration of the UN Global Road Safety Week. And this year, as we've heard, we gather under a theme that is crucial, central to the vision of sustainable and livable communities. And that, of course, is active mobility, and in particular, safe walking and cycling. Walking and cycling are more than just modes of transport, as you've heard. They are essential for creating healthier populations, cleaner environments, and more inclusive cities. They help to reduce congestion, lower emissions, and of course, foster human connection in ways that no car ever could. They are key components, as has been mentioned also, of the Global Plan for the Decade of Action for Road Safety, which emphasize multimodal transport and land use planning as a means of ensuring safe, equitable, and sustainable mobility for all. Around the world, we have seen encouraging signs. Walking and cycling are on the rise. This is indeed a very positive development, but it has come with a sobering reality. As more people walk and cycle, more people are also dying on the world's roads. This tells us one thing clearly. We are not doing enough, as our colleagues have already said, to make these modes safe. According to the Global Status Report, our most recent Global Status Report that was launched in 2023, more than a quarter of all road traffic deaths globally are among pedestrians and cyclists, 26% to be precise, 21% among pedestrians and 5% among cyclists. And it's actually interesting to note that there has been a huge increase in the number of cyclist deaths, particularly as electric bikes have actually allowed more access to cycling over the last 10 years. So it's interesting because the very people who are contributing to cleaner, healthier cities are also the ones that are at most risk. And this, ladies and gentlemen, is simply not acceptable. So in moving forward, we really must change the way we design and manage our transport systems. We must shift the focus from moving cars to moving people and to moving people safely. That shift, of course, requires then more than just infrastructure. It requires a change in mindset. We need leadership, investment, and action that prioritizes vulnerable road users and puts safety at the core of urban and transport planning. I'm happy to report that this message was echoed loud and clear earlier this year at the fourth Ministerial Conference on Road Safety that took place in Marrakesh, Morocco, between February 18th and 20th. And I know that many of you were there. And the resulting Marrakesh Declaration reaffirmed global commitment to the global plan for the Decade of Action for Road Safety. And it called for the protection of vulnerable road users, especially pedestrians and cyclists, as a top priority. It recognized that making walking and cycling safer is not only a road safety issue, but also a health, equity, and climate imperative. So let us carry this momentum forward. Let us ensure that walking and cycling are not just encouraged, but also safeguarded so that every journey on foot or bike is a step towards a healthier, more sustainable, and more just world. Today's seminar is an opportunity to reflect on that challenge and to explore practical solutions, particularly in this region, that can make walking and cycling not only more common, but also much safer. I thank you once again for being here, and I look forward to a meaningful and action-oriented discussion. Thanks so much. Back to you, Ignacio.
Muchas gracias, doctor Nantran.
Thank you very much, Dr. Nantran. And well, just to be able to close this part of welcoming words, I will now like to greet and introduce to you Dr. Juan Luis Castro, who is the Vice President of the Health Commission of the Senate of Chile and a member of the leadership of the Parliamentary Network of Latin America for Road Safety. The work of parliament members, legislation, regulatory frameworks are fundamental to be able to continue promoting the activity that is secure and safe within the roads. And Juan Luis, thank you very much for being here with us today. Good morning. You can now continue. Thank you very much, Ignacio. It is a pleasure to be able to be here with you. I would like to welcome every colleague here from all of the Latin American countries and the Caribbean countries, also from the USA and Europe that are here with us today. It is, I have formed part and I have been leading the Commission of Health in our country in the Senate, and I've also formed part of the Transportation Commission of the Senate in Chile. And that is how this is able to help to say, for example, that the third cause of deaths in Chile are the road accidents, and particularly accidents in reference to this have been growing throughout times in public roads, in traffic, especially since for the last couple of years, the cycle paths and everything that has to do on to people now using more of these streets, roads, using not vehicles, but using bicycles, motorcycles, and all of the cycles that in a certain way appear have definitely increased the quantity of accidents. The culture of who drives the vehicle does not adapt to living together in the public path with those that appear to be diminished or more fragile in their bicycles or in their transportation means that of course today continues to be a vulnerability. In Chile, for the past 4 or 5 years, we've actually been working on this. However, the culture, the mindset of citizens that are used to using their vehicle, cars, they're not able to assemble yet, and we have this traceability of access that still exists. Our country, and we'll see that in the seminar, possibly also has a subdevelopment in this cultural aspect of a road living in an ordered and civilized manner, and where this happens and starts from where who receives the the driver's license, which in Chile is provided from the municipalities, until those that have, let's say, mental health issues or physical and biological issues that have not been detected that make them, when they are driving a vehicle, they can suffer alterations that lead on to having accidents. In this sense, there is a new law that possibly it's just as in other countries, it has the name of a line, which is called of a girl, which is called here in this case, the Jacinta law, which is a case of Chile of a girl named Jacinta that was hit by a person, an elderly person, but that has a physical and organic issues that would have made them not viable to be to be driving a vehicle, and that person killed this girl. In Chile, in the next years, we're going to have a special legislation that is going to elevate the standards and the declaration of organic health and mental health for any driver of a motorized vehicle. I think that it's going to be very helpful. Unfortunately, all laws are reactive here in the occurrence. We see that they generate this commotion. So for our country, it is very important to be able to participate in the seminars. We'd like to thank Ignacio Ibarra that has been the permanent liaison with our country to be connected in road safety matters. We would like to wish you the best success to all of the colleagues, professionals, everyone that is here present in this event. Thank you very much to each and every one of you. Thank you very much, Senator Castro. It's a pleasure that you've given us the opportunity in your very tight agenda for you to be able to deliver this message. Thank you very much once again. We will now give the floor to the agenda itself, the specific agenda, and we will be beginning with my colleague, Dr. Ricardo Perez Lunes, that is the Regional Advisor for Road Safety and Prevention of Non-Intentional Injuries from FAHO in its headquarters in Washington, who's going to be speaking to us about the regional perspective of active mobility, safe mobility, and sustainable mobility. Ricardo, go ahead, please. Thank you very much. I would like to thank each and every one of the authorities, government, and legislative activities that are present, and also the representatives of the organizations of civil society that are here with us and distinguish us with their presence today. Something that countries have given us to the organization is to be able to prepare reports that talk about the progress in reference to road safety. The fifth edition of of the Global Report was published in 2023, and it has an application where you can have access to key information at a global level, where you can have an analysis at a regional level, national level, and hopefully all of you have had the opportunity to download this and that you can actually use this to be able to promote this agenda in your different contexts. And I hope that you've also had the opportunity to be able to see the most recent regional report that was published in December last year that has the same information, and also it includes an electronic version of quick access for a more interactive consultation that definitely facilitates the work in reference to safety in countries. Report also presents the profiles of road safety for each country with a little bit more of detail to be able to facilitate the identification of the main gaps in the implementation and the recommendations of the World Plan for each of the areas that are priority and that will also be used here. The regional report also has a space for the monitoring of the progress and the compliance of the 12 World Development Goals. And this progress is being analyzed at a regional level by subregions or a level of entrance. And also in the right of the corner, you can see here the progress in reference to goals 3 and 4, which has to do to be able to promote health standards for road safety, and where it's possible to be able to see that we are so far away from seeing all of the countries of our region actually meeting the indicators correctly. This is more evident in what was mentioned in the World Report, the Global Report, where it is stated from a sample of 500,000 kilometers of road infrastructure that has been evaluated by IVAP, which is one of the main promoters of road safety infrastructure in 82 countries. Only 21% of them had a qualification of 3 stars or more to be able to protect pedestrians, which is what was commented by Dr. Silvana, and 23% to guarantee the cyclists' safety. Now, maybe IDF has been now having a larger sample and they're giving this information by country and region, but it's very clear that the proportion of safe roads is quite low in a way that to be able to promote the active mobility needs to go together with a safe structure, as how it has been mentioned by Pedro and Dr. Nantran. In reference to safety management, another interesting data of the regional report is that the 32 countries that are participating, uh, 30 of the 32 countries participating, 30 of them have the coordinators, have coordinators, and we are able to see that 20 have national strategies and only 5 of them, which is concerning, only 5 of them have financing to be able to use the strategy in a satisfactory manner. And it's also important to mention that this strategy does not include any specific goals for reduction of the number of deaths or severe injuries, or for this week to be able to walk or use bicycles as an alternative. To be able to define a clear goal, it allows us to be able to see how much we still need to work on and what we are still needing to do. This is work that is needed to be done in the countries of the region. When we analyze the key data for suitable road safety management, we see that it is actually very few countries that actually have information systems that can document the distribution and frequency of trips and also the type of transportation, for example, to go into school by the population, fundamental population. There are very few countries that have statistics of reports in reference to walking, pedestrians using bicycles, cyclists, or other means of transportation, such as scooters, for example. And definitely this highlights the fact that we have a very important area of opportunities to be able to work in the region. The report includes some indicators in reference to being able to know the situation of strategies that look to promote a sustainable, safe, and health strategy. Here we have the analysis of 4 key indicators: the promotion of access to public transportation, strategies to promote alternatives in the use of individual motorized vehicles, policies that promote walking or using bicycles instead as alternative uses, and also progress in reference to the last 3 indicators, and very few progress, and that is why we have a lot of red here, you can see. And 5 countries have had progress in these 4 topics, and I will put them in green. And I think that this talks about the fact that it's possible to continue. You have the decision authorities of the local communities. And of course, to be able to implement this, I think it's important. And one essential part is to be able to have this mission, to be able to establish the policy, to be able to continue. And with the tools that our colleagues will be presenting now, other countries will have the opportunity of being able to have progress in this sense. And this is part of the contribution that as an organization, we are looking to be able to develop tools that are able to be useful and that can actually help throughout local work.
Sí, hacer dos reflexiones finales. La primera tiene que
If you
ver
allow us, I would like to make some and some final reflections. It is necessary to accelerate implementation. It seems that we won't be able to reach our goal for 2030 regarding the trends, and so we have to really make progress. There are many lives lost every year in the region, and for each person that dies, there are at least 18 that receive that are injured, even if not lethally. So we have to work with our strategic partners and our financiers to make progress. And the second reflection I would like to add is that there are countries that have been able to reduce the number of deaths and the rates associated to that. Trinidad and Tobago in the region is the only country in this report that was able to reduce the number of deaths in 70% or 50% or more in this. And we would like to really learn about their experience. And there's also progress made by Argentina, Panama, Cuba, etc., that reduced the number of deaths significantly. And this means that it is possible to make progress. And we're not talking about high-income countries or European countries. It is possible in our reality to make progress. And but this progress has been eclipsed by the negative trend observed in some countries. So the report shows different different trends in our road to success, and we believe that this will become more evident in the future. In green, you see the countries that have made progress here, and I would like to include this slide and to keep track of it to see the progress made. And we have been able to document how different countries and cities have made progress in specific issues of road safety. You can look at them on our webpage and the different publications you see here. And so we would love to publish and present more successful stories. For example, the city of Guadalajara in Mexico. So I'm happy to have shared these reflections with you. Well, thank you very much, Ricardo. As you see, things are not going wrong. I mean, the reports are very important and show us that we are making some progress. And as Ricardo said, there's also the creation of and participation of parliaments, ministries of health, and transit authorities, because all this is it's a comprehensive effort. And I would like to hand over the floor to Dr. Fiona Bull, who will talk about the launching of the toolkit of the PAHO about walking and cycling. It's not just reducing motorized transport, but they allow for alternatives. Dr. Bull?
Thank you very much, Chair, Dr. Ignacio. It is a great pleasure to join you from WHO headquarters at Geneva. My presentation will be in English, so I invite those to turn to the translation as needed using the interpretation at the bottom. And I'd like to share the screen and bring up my slides. If you would confirm that you can see the correct format, that would be most helpful.
Yes.
I see you nodding. Thank you very much. So good morning, good afternoon, and good evening to you. It's lovely to join the Americas for this week to celebrate with you, as this week draws to a close, the 8th UN Global Road Safety Week. And I come to you from the area of physical activity and health promotion and promoting walking and cycling for all the reasons we've heard already, and how important it is to collaborate across different sectors, across different issues, and road safety, of course, is at the top because of its importance. Moving on to the launch, it's a great pleasure to have a few moments to introduce what we launched on Monday at the start of this week, a new resource from WHO on promoting walking and cycling, a toolkit of policy options. I'm pausing here in case you'd like to use your phone to get the QR code, and I'll bring this slide up at the end as well. And over the next few moments, I want to discuss with you, well, why now? What is it? And who is it for? So why does walking and cycling matter? Well, Silvana gave a wonderful introduction and welcome to us with many of those reasons. And of course, walking and cycling as forms of physical activity and exercise can improve health, reducing non-communicable disease, and improving mental health and social connections. And if we design for safe walking and cycling, we can reduce road injuries and road fatalities, as we've heard, levels of which must be addressed as a matter of urgency, and we're drawing attention to this week. Walking and cycling, of course, are sustainable forms of transport and therefore contributing to our important global agenda to improve the environment and have sustainability and reducing air pollution and mitigating climate change. And Silvana also mentioned the value of walking and cycling to local economies and national economies, as it can be through creating and supporting local retail, as well as tourism, and through the physical activity and reduction of non-communicable disease, reducing the burden on our health systems. It's an equity issue, has also been mentioned. Fair and opportunities and safe opportunities for all to walk and cycle in modes that are comfortable and accessible is a social equity agenda. And of course, it's about mobility in our cities, as Nan mentioned, creating the livability we want now and for the future generations in our cities. The toolkit has been developed because of the inaction. And we just heard Ricardo's reflections about the need to accelerate implementation. Stats you've already heard are shown here and potted through the toolkit. The concerns we have about the current infrastructure, as highlighted by Ricardo, our infrastructure not meeting safety standards for all users, particularly vulnerable users, particularly pedestrians and cyclists. And we've already seen some data about the promising but still insufficient progress in having policies, targets, and coordinated action. So we believe that now is right to have a toolkit to help all countries and cities progress. So what is it? Well, first and foremost, it picks up on the Global Action Plan for Road Safety and the Decade of Action on Road Safety, amplifying many of the messages and calls that are in that document and evidenced by the data we've just had shared. It also complements and supports the Global Action Plan on Physical Activity, shown on the right-hand side, and our global status report on physical activity also showed worrying levels. Levels of physical inactivity are not increasing. Implementation of known and effective policies is not widespread, not at scale. It's uneven in where it's being done and how much is being done. So this toolkit amplifies because it provides now the implementation guidance, evidence-based, comprehensive, cross-sectoral, practical, and impactful if implemented. It's not alone, and I want to recognize that it joins a suite of existing resources, each dedicated to specific areas, and then amplifies those with some of the how-to and case studies I've mentioned, and including the ones noted there from the WHO and other UN agencies, and international agencies. We can see there are resources also to support in the Americas. Moving on to what's in it. Well, firstly, here you see it's structured around providing guidance in 7 policy areas, all color-coded. Each area outlines what can be done, should be done, we can do. And this page is actually at the very back of the report as a resource for you. What I'd like to do is take a few moments to have a look at those in more detail, just briefly, given the discussions we're going to have in the rest of the seminar. Given it's Road Safety Week, let's start with a safe systems approach, designing our streets for all and making sure they're safe. So one of the policy recommendations is good street design. And we have tools guiding us. We call on countries and cities to adopt and adapt, implement and enforce. We have, of course, as part of the safe systems, is ensuring safe road user behavior. So speed matters. And here we're seeing the illustrations of course, recommendations, modifications in certain areas around schools or residential areas. It's not just speed. We know alcohol, phone use, distracted driving are all important. And indeed is safe road user behavior by cyclists and e-bike bicyclists as well. But this is an important area complemented by making sure if we create good street design, good road user behavior, we then must protect and prioritize walking and cycling. Ricardo talked about encouraging, and I like to add to the encouragement the protection and the prioritizing. Spaces designated for walking and cycling must ensure that they're used for those and prioritize. So we have problems with vending, vendors taking up space, rubbish, perhaps obstructing the use, and other parking illegal or such. We must look at the regulations and enforcements to protect and prioritize our spaces for walking and cycling. As we go round the clock, you'll see some familiar places because the toolkit is populated with case studies, but we must then make sure we integrate walking and cycling with public transport. And just illustrated here, ease of access and transport-oriented design will make sure that the first and last mile can be incorporated, and bicyclists are encouraged in different modes to integrate with public transport to facilitate longer journeys. We also, I'm sorry, I'm going backwards. We also turn now to the top because, as has been mentioned already, we can do all of those, but we must have the core infrastructure, the safe, connected networks for walking and cycling that take us to the places we want to go, whether it's for transport trips, recreational leisure, or exercise and health. And so we can see here, retrofitting in some parts of the world, planning forward, using tools like the health economic assessment tool we'll hear about to create the investment case for investing in infrastructure. But all of these, all of the areas I've covered will require the overarching governance and leadership. And so we're seeing here that number one is actually integrating walking and cycling as a priority in all relevant policies. Of course, that's transport policy, but not only. Health should support, tourism, sport, education. There's a role for everyone, and there's a need for walking and cycling to be more visible, more prominent, and in the policies, setting targets and setting the plans of action for countries and cities. Taken together, this is a set of policy options to implement and, as Ricardo said, accelerate progress. But how will we make it happen? The toolkit contains a section on the enabling factors for success, and these will be familiar to you. They've been successful when applied in the areas of tobacco control, more recently in the area of tackling healthy eating and reducing obesity. We need to have strong governance frameworks, I've mentioned, community engagement for co-creation of these spaces at the local level. And we must use and leverage the power of legislation and regulation at the highest level. And we're very impressed to see by Mexico the implementation of, at the highest level, the Constitution of the Declaration of Safe Mobility as a human right. Advocacy will be important to keep the focus on safe walking and cycling and prioritizing. But it won't happen unless we build capacity in all the sectors, from the grassroots, those who are designing streets, those who are making decisions, those who are trying to raise the finance to support the infrastructure and implementation. And finance, of course, and no doubt will be discussed as one of the barriers, and we must unlock financing by good evidence and monitoring, sharing success stories, but also holding ourselves to account with good data to show progress and show areas in need. The toolkit is for everyone. Many of you on the call here from government at all levels, from different sectors, civil society, advocacy, academics, a role for the private sector as employers, but also as advocates for the safe communities that their employees work in and they wish to support for the future generations. And of course, my own colleagues and colleagues across the UN system. Everyone has a role. A particular role for, of course, our young people and their voice to be engaged to ensure holding us accountable, but also making the environments and the future sustainable mobility that we want to see. It's not alone. I want to draw attention to the work that many are doing across the world through the Global Alliance, through the FIA Foundation and other partners like Bloomberg, the coalitions that are coming together, bridging walking and cycling, such as the Path Coalition, and of course, known entities in the walking and cycling area. Everyone's voice is needed. collective action will be important. And in the Americas, we've got excellent work being led by some of the institutions like the World Resource Institute with lots of initiatives. We can make it happen, and we hope this toolkit will provide the implementation guidance for you to use. There's the QR code again, and I thank you very much for this opportunity and wish you well. Thank you, Chair.
Thank you very much, Dr. Bull. Las intervenciones de la doctora Bull han sido fenomenales. Nos ha mostrado que todos tenemos que trabajar juntos con el objetivo de
Dr.
poder
Bull has shown us that we have to work together and reach our goals. That is to have a safe system and lower the number of injuries and deaths and achieve a greater welfare. We have about 355 people connected. I believe this is really formidable. And we are leaving messages in different sectors. I would now like to introduce Dr. Lugo, who is the advisor for air quality and environmental issues for health at our central office in Washington. He will tell us about the economic tools to promote walking and cycling, and on behalf of WHO. And there are also other goals, as you will see, when we promote road safety. Juan Jose, you have the floor. Thank you, Ignacio, and thank you, colleagues, for the invitation and for the congratulations. And this reflects the importance of this issue for the region. We can all be affected or are affected by road safety, and I would love to comment on the tools, on the tool called HIT, that is a tool for assessing the economic impact of cycling and walking. So, well, this slide is sort of complicated, more complicated than our message maybe, but we want to stress that urban design, the way in which our cities are designed, will have an influence on our behavior and our choice of transport methods, public transport, bicycles, or just walking. And there are different factors of disseminating this information among the population. For example, social contacts, and all this has to do with activities such as walking and cycling, and will also have an effect on diseases. If we are exposed to environmental pollution, of course, our health can suffer, but if we promote physical activity, then we would have a possibility also of reducing these factors and promote health. We work together with WHO in active mobility, that is walking and cycling mainly. And I would like to point out that active transport has different interactions with the environment, and we're talking about the possibility of reducing motor traffic or reducing ultraviolet radiation, and also a reduction in greenhouse gases because we're not using fossil fuels for transport or less. And less type of this type of fuel. And these factors lead us to see how they interact with active transport. And it also promotes social interaction because some of us will be convinced to try it out if we see others doing it. And but if we can also fight against climate change and thereby reduce higher temperature, this can also be an incentive. And the heat tool is not about heat, but about health and economic evaluation assessment tool. Helps to estimate the health impacts of walking and cycling and the economic impacts on health, especially by reducing mortality of walking and cycling. And it also helps us to estimate the reduction of CO2 emissions or equivalent to CO2. And what does this heat tool assess? It is mainly, it does a follow-up of cycling and walking and the traffic incidents, the inhalation of polluted air and the emissions of CO2. Physical activity, well, for physical activity, it's a benefit. And for traffic incidents and the inhalation of polluted air would be the risk of active mobility that are also considered in the tool. And as a goal benefit, there is the reduction of CO2 emissions represented by the modal change. So the change in the mode of transport would lead to these changes. How many questions can we answer through heat? Well, premature deaths that are avoided each year because of active transport. How many premature deaths? How many premature deaths can be avoided if we increase active transport trips? And also establishing policies, for example, if you build roads for cyclists or paths for cyclists, this is of course a cost. But if we can prevent deaths or injuries, we will be acting against this cost. And also, we can see how many emissions of CO2 we can prevent because these estimates can also help us with climate change. And there are also potential tools for financing and in adapting to climate change and mitigating it. And this is a general view of this tool. It's in English and Spanish. It has a module where you can add the data and you get a summary of your input data and a summary of impacts on mortality and carbon emissions. This includes mainly the modal distribution on the area of study and the environmental conditions and road safety. If this information is not available in the area of study, we can also use secondary information that is also included in the tool. And as you see, the results are represented in this way. Here you can see the benefits in impacts on premature mortality and premature deaths avoided. Here we have in blue the benefits of cycling and walking, and on the lower part we have the risks that are caused by traffic risks and also air pollution. I would like to share For example, the case of Barranquilla. By the way, I would also like to show you the elements of avoided carbon emissions through cycling and walking regularly, because, of course, if we use bicycles, we can reduce also a lot of emissions. And how are the different cities using this information? For example, I will share some examples from Argentina and Colombia. In the case of Colombia, the city of Barranquilla built a path along the river for cyclists and also for pedestrians. And together with this, it included the development of a space for walking and cycling that the citizens can use, and that is accompanied by new green areas in order to prevent exposure to solar radiation. And this intervention means that you not only can walk and also do some exercise, but there are also campaigns for promoting health and increasing physical activity and reducing emissions, and it increases resilience of the city. So we used this tool in Barranquilla, and we accompanied the city in this change, and we saw that with the present intervention, not only this path along the river, with the present interventions and the promotion of active mobility, we are avoiding 344 premature deaths, preventing these deaths per year. And we are preventing the emission of 32,000 tons of CO2. And also we are the economic value per year, combining mortality and avoided CO2, is $160,000 million. And so we have 166 million and a reduction of 32 tons of CO2 and 344 deaths. This is part of the strategies for active mobility and better urban infrastructure. And this project will help also to finance this type of activities, and this is seen by the results provided. And here we have the reduction of deaths, the avoided deaths, physical activity, traffic incidents, and also accidents. And we see that there is a high increase in physical activity, but we also have an increase in mortality, because as we are exposed to particles in the atmosphere, this is an increased risk factor. But in general terms, we see that the benefits of doing exercise offset the risks of being exposed to air pollution. And we can also see that the same thing happens with traffic incidents, because both traffic incidents and air pollution are limiting in some way the benefits of physical activity. So we have to take measures, implement measures to prevent air pollution and traffic accidents that create a risk for the users or the pedestrians or the users of bicycles. because if they're at risk of dying because you are walking or cycling, this will be an obstacle. An important obstacle is the development of these policies. So we thank you a lot for this invitation to the conversation. And you can see here that there are multiple benefits in the protection of people and also the development of the cities. Here we have the example of three cities in Argentina. These are small cities, so the numbers are smaller also of prevented premature deaths, but they represent about 5% of mortality. So we can see that this works both in medium-sized and large cities and also in small cities.
Mortalidad en las diferentes ciudades evaluadas. Y un poco sobre próximos pasos es que nos permite tener, ese fue el
Here you can see the analysis in the different areas by areas and also by neighborhoods, historical analysis, and also the trends of how this is creating benefits for health and also future scenarios. So if there is a discussion about restriction of speed and tools for reducing accidents, we could see more benefits for health and human health and the environment. And it's a key factor to say that we can increase the benefits of these policies. And from PAHO and WHO, we have tools to measure these impact of the intervention. We will leave it on the chat so that you can get to know the tool. It's available in English and Spanish. And of course, we want to cooperate with Ricardo and his team and in order to help the cities that want to use this tool.
Muchas gracias, Juan José. Qué interesante posición nos presentas.
Thank you very much, Juan Jose. It's a very interesting position in reference to being able to see this as something fundamental. And I think that also in reference to all of the sectors that we work together, we are able to, of course, achieve all of the objectives. If you could please put the link here in the chat, because many people, of course, requested it. We have already seen the interest for this. Thank you very much for your input, Juan Jose. Now we will listen to our first participation of civil society with this perspective of seeing how non-governmental organizations can actually have an intervention in the work of promoting road safety and safe environments. I want to present Sonia Aguilar, Regional Coordinator for Latin America of the Global Alliance for Road Safety. The Global Alliance of NGOs for Road Safety. Thank you very much, Sonia, for being here with us, and you have the floor. 363 people we have here with us today. Thank you very much. Thank you very much to you, Ignacio, and to the PAHO for this organization. Thank you to everyone here that is with us today. My name is Sonia Aguilar, and I am part of the team of Global Alliance of NGOs for Road Safety. And today I would like to share with you a tool that we've been able to develop together with our member organizations throughout the whole world. And for those of us that don't know who I am, we are a non-government organization that has a coverage throughout the whole world. We are a part, or we started as a part of a collaboration of the United Nations. And while the Alliance is a network that joins and puts in the effort all of the organizations in the world working in pro of road safety, victims of traffic accidents. We would like to invite you to go into our website. We are a little bit over 400 organizations throughout the world. And under 8 countries, and we would like to start adding more organizations throughout all of this information. And in reference to our work, our vision, our mission, it is very important for us to mention that, as it has already been said by Dr. Fiona, the activists for rights of people to travel in a close manner, in a safe manner, we need for everything to be accessible, but also for it to be sustainable. And this is something that was done. It is very important. And for this, we actually need we reinforce the incidency in different organizations throughout the whole world in the review of accounts on behalf of the governments. We also, of course, support the development of capacities and the reinforcement of knowledge and experiences that allow that we are able to continue working throughout these objectives that are so very important that we share. And that has already been mentioned by Ricardo. We need a joint work to be able to achieve our objectives and goals, which is actually about saving lives and avoiding injuries. This has already been shared. Is quite a pity. Over 80% of the roads, let's say 8 out of 10 roads in the world, do not meet with the basic standards for road safety for pedestrians and cyclists. And unfortunately, less than 1% of these have cycle pathways. This week of road safety takes us to a safe mobility in reference to safe mobility of pedestrians and cyclists. And this is a dimension of the challenge that we have today. We know that this much change. We've accepted that the streets are not safe, that they're not that they are unsustainable. It's unavoidable. But everyone here knows what works to be able to change this reality and to transform our streets. We need for our communities to participate, for our local governments to participate, but overall to be able to place this right of people in the centers of mobility throughout the whole world, particularly in our region. This is a photograph of our organization in Argentina, where we are able to see what children are facing in general, people that are mobilizing themselves in bicycles. In reference to the tool that I would like to share with you today, this tool is a tool, it is a tool that arises out of this need, of this idea of being able to see the activism as part of a global movement that questions how there is a design and redesigning of the streets and who this is being done for. Now, what is most important here is that this campaign that this tool begins as of the launching of our campaign last year, and specifically in these dates in the 2024, in reference to being able to get committed towards action. And civil society for all of our regions and countries definitely started making these mobility parts to be able to put all of these populations in visibility in reference to the construction of infrastructures throughout the world. And here we are trying to put in visibility the danger that both cyclists and pedestrians have on a day-to-day basis, and also to create visibility in reference to having this street not only becoming for transit, and also they need to be spaces that can be occupied. And it's a double purpose. On one end, first, the tool evaluates to be able to see what needs to be done. And also in this part here, we also had the component of cyclists besides pedestrians. And also this evaluation is very important. And the scale of the evaluation is done through intersections. On the other hand, the other purpose is to be able to identify what interventions are priority to be able to implement, and also the tool facilitates an estimate of costs for this implementations. We must remember that the streets are not only these places for traffic, they also need to put in favor this part here in this picture that we are seeing. On the left, we can observe that we've had logistic transportation, we have pedestrian, cyclists, public transportation, etc. And in other words, it would seem evident that this is not a place where people can occupy this. We have rest spaces for this end. For example, this is an example in Africa, what we are seeing here in the image. And here, well, we are able to see that this road risks that we are exposing our populations to are highly dangerous for all of the users. And what we try to visualize are the mobility snapshots. It's basically this: who is able to develop a mobility snapshot? Anyone is able to do it. A mobility snapshot is a tool, like I mentioned, that is very friendly, that we invite you to use. Hopefully, this small part that we are seeing here is used, and we're going to be able to get more information. But it's a simplified version of star rating. It's a tool that we've developed together with our partners in IDA. You do not need to be any specialized engineers to be able to use this tool. You don't need to have any knowledge and reference to this. The tool has a guide that is going to facilitate this from happening. And on the other hand, like I mentioned, once we have the evaluation of the intersection, you will have information in reference to the potential number of stars that we can have in reference to us being able to have the elements of road safety. On the other hand, something that we've already and always mentioned in different forums is that we have created e-users, and these e-users, what this tool looks to do is to be able to use these tools evidenced on the fact that campaigns are to be promoted in this way. And something very important that I would like to mention is that could be any street in Latin America. We see the inequity in the space distribution of infrastructure that is here. We have many vehicle lanes and a small one for the bus on the right. These are the conditions in reference to the different users. And how can we have a mobility snapshot? This is relatively simple. Uh, Here we need to identify the intersection, and it can be one intersection or many intersections. We can have all of the mobility snapshots that are being able to set here, and they could be in places that are quite risky, correct? And once we are able to identify this, we evaluate the conditions of mobility that exist today, how many number of pedestrians, cyclists are passing through this area, under which conditions, if there are safe speeds or not. And once we have this evaluation, we can fill out this format, we can put it into our website, we can process this data, and we can go back to you with a diagnosis or information that allows us to be able to have this advocacy and to be able to be linked to the campaign. In summary, it's a standardized process that looks to be able to guarantee the coherence and the reliability of data, and also here the localization of the area which is selected by the activists. Now, this is how we would see the infography once you are able to upload the information. We are going to have a main element, which is a visual element to be able to show the problematic, which is a photograph of the current situation of the intersection. And on the other hand, we are going to have something that is very important, which a minute ago we heard in the voice of Silvana Enan, which is the importance of prioritizing the mobility of people over vehicles. And for this, it is fundamental for us to be able to start telling all users, and our infographies also have this information here with the number of people that are walking at peak time, peak hours, and the mobility snapshots are able to guarantee that we are actually counting all pedestrians in all of the intersections where we are able to develop this campaign. On the other end, I'm going to show an example now of our organization, Madres del Dolor y Bien Argentino. It's an NGO. This mobility snapshot was developed last year as part of the campaign, where we are able to see the evaluation, which is what's going to be seen here on the left and on the right. Here we're able to see how we can do this, and the potential that I was mentioning definitely has an improvement of road safety. For example, we can put the part that the redesign of this intersection, we can pass from 1 to 3 stars, and the estimated cost is $50,000 to implement these improvements. So we're able to see that the cost is quite marginal in reference to the benefit that can be obtained. And well, I think this is quite inspiring in reference to also in Argentina, the organizations that began seeing the mobility snapshot last year. And it shows us how from a local and national end, you're able to see changes, considering that last year they were able to develop the mobility snapshot with the support of the Subsecretariat of Planning. And right now, there's a development of 3,000 blocks in a municipality of Argentina. We've had the incorporation of curves of suitable signing, pavement, and bicycle paths. What is important here is that this initiative has been able to obtain through our organizations to be able to extend and include other 750 blocks. These improvements have been promoted by the municipality, and also they have the implementation of priority actions that we know are very much important, such as the implementation of in a strict area, the use of the reduction of speed and traffic lights, and something that we also consider that we need to highlight in this dialogue is in reference to control. Through the installation of cameras, you've been able to reduce 20% of this registered road incidents. We must remember that we are not always going to be able to have the police there with us 24/7 in our streets, but technology is also helping us and it's facilitating us to be able to have some kind of control. This project shows us that streets can be redesigned, but on the other hand, many times we omit something which is maintenance, the good status of the good conditions of the roads. And like Dr. Fiona mentioned, the importance of not only having infrastructure, but for this infrastructure to not have any kind of obstacles. And well, I invite you, of course, to read a little bit more about the mobility snapshot of the city of Neuquén. And of course, very good news, which is that this is of national interest for the Parliament of Argentina, and we hope to have this replicated in more streets. On the other end, this year we've had another round of mobility snapshots, and this is part of the examples that we've had. We've been seeing here in reference to being able. Here we are able to see the examples, and right now we are able to see this on the and there's not going to be any alignment. And this is going to be from our organization Madres del Dolor, and this is a part of the mobility snapshot in the city of Mexico. We're able to see that we are can see that this is very close to an area in the city of Mexico. It's very close to a mall, a shopping center, and the conditions that the pedestrians are exposed to. We don't have any walk-in path. We don't have any priority traffic light or anything. In Mexico, there are 50,000 people that die in traffic accidents in a year, and this shows the lack of measures to reduce the speed around areas where there are high volumes of pedestrians. The mobility snapshots are used also to be able to involve the community, and this is very critical to be able to link these to communicate and promote our requests. In this sense, we can use these to be able to involve also those decision makers that are going to be able to make this reality. And in reference to being able to see small videos, clips, campaigns, and to be able to have messages in each intersection. On the other end, how do we fast from this campaign to this incident? Well, in this sense, we can actually use mobility snapshots to be able to see what is being done. And here, in the reference to the hashtag make it safe, we've been able to visualize these interventions. And here we have a toolkit of primary interventions. In this case, the speed, we do know it's critical in reference to being able to have this end. And also installations or for pedestrians, such as walk paths, traffic lights, road signage, and also the calm of traffic throughout different infrastructure ends. And once we have been able to identify, once we have a campaign, as we had already mentioned, we need to involve the community, and that is key. And for this, we need to be able to reinforce these arguments. These arguments can be reinforced in different ways. We just leave you here some of the ways that we've been able to identify these through our organizations, but one of them is throughout surveys of perception, also specific petitions that are based on data throughout different activations, signs, interviews. Communication media and social networks have a very important role to be able to disseminate the actions and also to be able to have follow-up and look for the commitment in reference to decision making. In reference to decision makers, this is also different parts in which this campaign is able to facilitate the interaction with them. And this, let's say, it's a show and tell. It's about being able to explain what has been done in this intersection and how we've been able to modify and redesign and how we've been able to integrate certain elements in reference to safe infrastructure in the intersection. That is very much useful to have a before and an after. And we also know that to be able to have all of these processes done, it is always very important to be able to have a clear coordination. And definitely these roundtables are a way of approaching these kind of elements in reference to being able to prioritize this intervention and also to be able to scale up best practices and to be able to see in reference to these omissions, in reference to being able to share data and, like I said, to be able to involve these ends. And again, our toolkit of tools is in our website. You're going to be able to find more details of what is happening, and in this sense, what we are doing throughout this week, which is our calling to action. This calling to action is led onto governments throughout the whole world to have the incorporation of people such as this main and in reference to design and redesign in public spaces and interventions. And this in reference to the organizations set throughout the mobility snapshots and to be able to see here and seeing how we transform these intersections. And here we have the information in reference to being able to set here these resources can be completely marginal in reference to being able to set $5 million. And this can have the potential to be able to create the safe intersection. And on the other hand, our NGOs should call on this action to continue visualizing unsafe streets to generate this demand for mobility, safe mobility that all of us have, and to be able to continue requiring these parts of transparency on behalf of our governments, to be able to establish, to have these sustainable places which actually require the commitment of everyone. And although some of us are all pedestrians at some moment of our times, to be able to walk and use a bicycle is definitely being able to be sustainable, equitative, and democratic at that time. And when we guarantee these conditions of safety, these become powerful solutions, as we have already mentioned, for many of us in our agendas and the challenges that are being faced by our society. This eighth week of road safety for the United Nations is a key opportunity for us to become this vision and a mission to be able to work at all levels so that being able to walk and riding a bicycle is safe for everyone, everywhere. I ask you if we can please continue visualizing and seeing this part here in reference to the users, especially of those most vulnerable ones, girls, boys, youth, people with disabilities. And we must remember that if we are talking, of course, we're talking about lives, people, infrastructure. Infrastructure goes beyond or is just tangible. This allows us to be able to materialize the right. It becomes an habilitator of rights to be able to connect with our activities in reference to the day-to-day work, that's daily activities that we have. And in reference, we ask all of you to be able to visualize this, and we also ask you to be able to discover a little bit more in our website. Like I reiterate, it is open for the public, it is easy, friendly, and completely free of charge. Thank you very much. Thank you very much, Sonia. Thank you very much. The information in the spectrum is very much interesting. Like you said, we need to show what is not good, but we also need to incide on the fact of things need to change, not just leave it on a photograph or in an image. We need to invite parliament members, Congress members, not only to see laws, but also to be able to have a public service of all of the governments in reference to being able to have snapshots. I think that we can ask parliament members to also participate in this scheme. And we are a little bit late in time, so let's start going. Now we have Dr. Carlos Cañas Sanz from the Walk 21 organization that is going to be presenting a tool of walkability. It's very interesting, actually. We will now hear you, Dr. Cañas. Thank you very much. Thank you very much for the invitation to this participation. For me, it is a pleasure to be able to have the opportunity of presenting the work that Walk 21 is doing with the Walkability app throughout the whole world. And basically, we see that this Walkability app is a tool that is technological. It is a mobile application. It is available in Spanish, English, and in other 7 or 8 languages. And we can use this to be able to measure or to be able to have a better understanding in the walkability of a person, starting always from the perspective of the pedestrian. We use the observations and the experience of pedestrians in public space to be able to see this part. And I'm going to present 2 different projects now that we've used in the Walkability app in 2 ways. A first project, here we are able to see here as part of the Plan Safe project to be able to improve the road safety in Africa, where there were interviews made to pedestrians, and also the second project here in reference to being able to have a small island in the Mediterranean, where we have this project with the students from elementary school. And something to be able to show you the interface of the application. I'm going to show you a complete interview of this project. But before doing this, I would like to explain that the data or the information that I have in the Walkability app can be classified in 4 categories, main categories. We are looking, we're looking to have information about pedestrians and in reference to information of the walk, experience about information about the experience of the pedestrian, and finally information about the home that is being studied. This interviewer uses the Walkability app to be able to ask a participant on the street and to be able to introduce the information and the data through the app. The information that we took regarding pedestrians is basically age, gender. We also ask about their viability, also difficulty of them being able to walk, the difficulty of interacting with their surroundings. And finally, we also asked about the level of physical activity, how many minutes they usually walk throughout the day. And this is the information that we mainly have from the participants in our studies with the Walkability app. And also the interviewer was asking about the context of the walk, and this is very much related to the questionnaires of mobility. Here, they were asking if the pedestrian is walking by election or because of need, necessity. They're asking if the walk is part of transportation or just a pleasure activity, if they are walking alone or accompanied with someone, if the participant is local or distant. And then we start asking regarding the experience of the walk. And here we have a scale that comes from a very negative experience, negative, neutral, positive, and very positive, with these colors that you are seeing, that you're going to see in this presentation. Once the pedestrian says, yes, the experience is positive or negative, then we also ask what kind of experience is more determinant. If it's more related to safety, to the community, to pleasure. And this app also has the opportunity of putting others where the participant is able to indicate other kind of experiences, such as, for example, accessibility. And therefore, we choose the type of experience is being shared by the participants. And finally, the last part of the interview is to ask why. Why? Why do you have a positive experience? Why do you feel unsafe in this area? And here the app has 12 categories that describe characteristics and elements of public dispatch. And well, in this case, I've put here sidewalk. Yes, basically, yeah, that's what it's called here. Here also the categories of sidewalks, the passing of pedestrians, or the urban affecting barriers, all of these things. On one end, the experiences, and on another end, these categories are all based on research and policies of sustainable mobility and walkability. So yeah, this definitely the pedestrian is able to identify one or many of these categories, which means also what they've been able to see within their experience. And then in an optional way, to be able to have more data, if, for example, we have here, we are able to see what kind of characteristics we are able to determine this in reference to the, if it's the width, if it's the surface, the absence of the road, and this also happens, absence of a sidewalk, and this happens in reference to being able to see the visibility, the organization of this crossing in reference to all of this. And finally, and like in the previous presentation, we were able to see that we can have one image here of the place to add more information. And at the end of the day, I will ask you to explore the app, but we have other functionalities that can be used beside this.
Se salva esa entrevista.
Well, and once you have ended your interview, there's a saved and it appears on the map like this. And there are also interviewers that were trained, and they did 480 interviews that were related, or that really well turned in 1,500 observations and elements and characteristics of the public environment. And one of the things what we can see here is who is walking, and you can see also, well, by age, by gender, by difficulty or ability, or by activity, and we can also see who is not walking there, because in this, well, this shows that it's not a friendly environment. For example, we have very few elderly people, and more than 70% are not going, are not walking because they are enjoying it, but because of need, because there is no public transport, or they don't have another way of getting where they want to go. So if we see that experiences become more positive when they have the funds to buy a car or a scooter, well, they might not be so much enthusiastic about it. So when we ask about the experience, the next thing we can do is understand if the area has more or less positive or negative experiences. Unfortunately, more than 50% of the experiences were negative or very negative. And we can also see that top five of the of the most interesting characteristics mention specific characteristics. And there are good parts and bad parts, usually along the same way, oftentimes in the same street. But we can learn from that and we can identify the bad parts in order to really, well, pave them over or improve them. So I'm showing you here in the map some of the observations. As you see, you have the coordinates, so we can know where these experiences took place. And so we can compare also the experiences in the same space. These red or orange hexagons show mostly negative experiences, and the green ones show good experiences or positive experiences. And this helps us to identify the areas, because sometimes it's very difficult for the city authorities to know where to start. And this helps them to find out what should be done and where. This is an example, this graph is an example of priorities among regions. As you see, if the elements are on the higher part of the screen, you have a higher number of people talking about that. In this case, the barriers or obstacles were very important. And more than 20% of the experiences mentioned barriers or obstacles. And if it's more green, there are more positive experiences. And we ask about age, gender, difficulty to walk, and we see that the same space is perceived in different ways depending on the person. We usually have children and also people with reduced mobility that share more negative experiences, or because they have specific needs or difficulties to walk or get tired very easily. So we also see that the women share more negative experiences, especially concerning safety. And these data are very important for planning, for urban planning and improvements to be made. And the most important thing about this project is that when we analyzed the data in 2024, we saw that there were many improvements, and these were reflected in the new results. We had a redesign of the entry doors to schools, also less traffic and traffic lights, etc. Here we have, well, we can see that the methodology is quite easy to use and robust. And here we can see the real impact. And in this case, it's evident that many of the negative experiences were reduced, and the neutral ones are increased. So they consider it an appropriate space, and not very good nor very bad. And the positive experiences also increased quite a lot for experiences in general and also for safety experiences. And here we have with the pedestrians talked about something, they reported more positive experiences after the implementation of improvements. And here we have, 5 minutes for the second project. This is a project of mobility. And here we didn't ask pedestrians, but we worked with a school, a primary school, and 30 students did a different, walked or made some walks around their school, and they took more than, or they noted down more than 400 observations. And unfortunately, more than 50% are negative experiences. Again, there were negative experiences, but more than a third were positive. And this is something that we always talk about in this app, with this app. Each time we try to use this app with communities, we don't use it mainly only for complaining about public space or submit complaints. They don't use the application for complaints. So we did an analysis, a similar analysis in this case, and here you can see what the most important elements were from the point of view of students. In this case, for example, again, problems with the sidewalk and the barriers, and but there were some very good experiences related with the application in itself, but also about ramps and other elements and safety elements. And so the most important thing about this project is that it is to be used by the community. And we were working with the students for 3 or 4 months, and they were able to learn how to analyze their own data and observations. And so they would have discussions among themselves and were also able to understand how important it was to add data and why it is relevant to have an experience of all together and what they could do to improve the space in the best way possible. And after these sessions we had with the students, we had a last event that took place this week at the school, an event at the school. And the mayors from the different districts or towns came, and also different politicians and also people from the transport ministries, and they were able to, the population was able to talk to their mayors and submit their proposals, and the mayors took it in a very positive way, and they committed to implement changes and improve the public space based on one of the proposal of the students. And in order to end this event, we provided some prizes for the students, and the mayors, we gave them this medal as future experts in mobility, and the reward as future experts. And so we are very happy with the social impact, and we would like to continue with these events in schools and other communities. And as I said, the Walkability app is free of charge. You can load it down for your phones, and if you're interested in using it, we will be very happy. Thank you very much. Thank you for this very interesting exercise you have showed us. I believe that it really creates a relationship between the citizens and their authorities. Thank you. We are quite behind in our schedule, but we have two last activities that are precisely those activities that promote active mobility in some cities in the Americas. And I would like to give the floor to Amanda Lopez Fabra, who is in charge of mobility in the city of Monteria in Colombia. She will talk to us about the experience in her city for active mobility. Thank you very much. We are very happy with this invitation by PAHO. And well, we would like to talk about the experience of our city in safety and road safety and better mobility. We have implemented a great number of strategies. I will show my screen now. Can you please tell me if you can see it? No, we can't see anything yet.
Ahora sí.
Now it's working, yes.
Pero no le escuchamos ahora.
But we can't hear you.
No sé si nosotros podemos reconectar el...
Hola.
Ah, ya.
Oh, can you hear me now? Yes.
Ahí escuchamos bien, pero no vemos la
Yes,
presentación.
but we can't see the presentation.
Ahora sí.
Ah, now it's working. Can you hear me? Great. Thank you. So, Monteria is a city in Colombia. It's near the Caribbean coastline. We have about 500,000 inhabitants, and 58% of the citizens live in the urban area. It's a tropical dry climate with an average temperature of 33 degrees centigrade. And these are the data. And here you have the mobility study we organized in our city. We see that in Monteria, we have about 400,000 trips a day, and 29% are in an active way. The people use bicycles and also walk a lot. And so we have been using, well, our strategy with the inverted pyramid, we have been prioritizing vulnerable users. So in the city, we have about 160,000 vehicles, and 59% of these are motorcycles. And this means that, it defines the mobility in the city, really. With our development plan that we started to implement on January 1st, 2024, we have some goals that we want to reach. For example, to reduce the number of injured people by traffic incidents or accidents, to reduce in 10% also the number of deaths, and to reduce the number of trips in public transport in minutes, and to increase the percentage of bicycle trips by 10%. And no, to 10%. And we want to implement a series of projects that help us to implement these or to reach these indicators. So regarding safe infrastructure, the focus on safe infrastructure, we started with some pilot projects in order to guarantee the safety of children and teenagers, and also to improve the kind of traffic. So we reduced the speed, for example, we established new speed limits, and we also um, put up some road signs, etc. We can show you a short video.
Bueno, esta experiencia fue en la institución educativa Cecilia Ayeras. Nosotros aquí
Well, this was the experience regarding schools, and we also had the support of the WHO and also the PAHO for road safety, and we are carrying out a series of investments in order to provide cyclists better spaces, more safer spaces. Right now, we have 57 kilometers of bicycle lanes, and we also are investing in projects and programs for public bicycles, for example. This project has been very successful at national level. We are quite an example for other cities, and we have 120 mechanic bicycles in two different locations. And in the future, we would like to modernize this system and include electric bikes and 3 more stations with these electric bicycles. We're talking about 30 bicycles, and this would increase the present demand. And so we would have about 15 stations and reach about 80,000 bicycles. And I also want to show you a short video about the implementation of this system. The transport is a key sector for sustainable mobility and safe mobility. We want to foster different types of transport systems, and we want to reach the goals of these projects in different cities in our country. Good morning, yes. I am inviting you to look at this from Monteria. Monteria has 6,200 people that have registered for these bikes, public bikes. And so there are about 1,000 and 1,200 bicycle rides a day, and we are contributing in this way to reducing emissions and improve safety, road safety. And the commitment is to reach a lower number of emission and improve mobility and improving also the reduction of emissions on the planet. In the video, we see the former Minister of Transport, Mr. Camargo, who was visiting our city and taking our city as a reference to implement it in other countries. And we also have projects. We also have other projects for safe spaces for mobility, active mobility for all ages, and these spaces are also used for sports and for activities for families around sports. And we also incentivize programs and projects, for example, evening cycling or night cycling, or we also are trying to reduce private cars twice a year. You cannot use your private cars twice a year, and we thereby promote the use of public transport. And so you can explore the city by walking or cycling, and also discover the possibilities of active mobility and its attraction. So we want to let you live the city in a different way. And this is the message and the strategy we want to implement. And with this type of initiative, we have increased a number of people that leave their cars at home and use public transport or active mobility. And we work with other programs, for example, Reach Your School Safely, or other programs that have led to very good results. I will show you a video of children reaching their school with the program 100 feet and bicycles. Well, another component would be the component about safe speeds in our local program of road safety. We have campaigns, pedagogical campaigns and others, and we have, during the whole year, we have been working on these strategies every day in order to provide citizens with this continuous message of please take into account traffic lights to improve the public lighting, and we also, we want to promote safety in all ways possible, and we want to promote culture projects, especially during the spring, so that you can see what the new features are and what are the best ways to take, and implementing also the law to reduce the speed limits, and also campaigns like Take It Seriously, when we talk about alcohol consumption. And with this type of campaigns, we were able to create an impact on the society. And in this way, we achieved very positive results in the city. And we also developed campaigns for cyclists, and also about well, with videos, with virtual reality, where we made people leave their cars, and so they make them take a bicycle, so that they got to know what happens when you have a truck just passing along you when you are biking. And we had a very large number of casualties and accidents, but these strategies allowed us to reduce these figures in 33%, and from 89 death casualties in 20 in 3 years, from to just a very much lower percentage. So we have all these mobility issues. We have reduced in a high percentage the casualties and injuries caused in road traffic. And so at a national level, we were the city that achieved a higher reduction in the number of victims of road traffic. And this is reflected in the results. And this is, well, we have been able to reduce, for example, the number of motorcycle accidents.
En este actor vial, y de fallecidos en este, específicamente en este actor vial. También
In this type of transport. We did not have any casualties in among cyclists, and that's also an achievement that we want to point out among all the achievements of our city. And we had certain challenges in the city to achieve these objectives. And one of them is where, for example, assistance to pedestrians by instructing the motorists and showing them that they were not the only ones on the road. And we tried to achieve, well, everybody wants to get to their destination very fast, so they use they use motorcycles a lot. There are a lot of violations of traffic regulations, and this was one of the great challenges we had to face. There was also a great dependence on private cars, and these strategies also help with this. And this investment in maintenance of buses, etc., is very high. We are working on that and consolidating a strategy to sustain these systems and projects. And as we are on the coastline, and we have a very high temperature in summer, we decided to plant a lot of trees, and also the green areas in the city. And as our topography is, well, we are in a flat area, this helps because you have not, it gets easier to take a motorbike, and our cities.
Here we can see that we were the first city with these achievements and recognitions, and although here in reference to 60% being them motorcycles, and here we were able to see here that we were awarded with 2 prizes for Guardians of the Road and for the work done in the year 2024. Here we are in the same effort. We are in this administration with the mayor. We are passionate for road safety. We are very much committed to this component, and we are been knocking doors in different entities to be able to get this entity not only from the public sector but also for the private sector and international entities, so that in that way we can continue adding efforts and saving lives in our city. For example, this kind of strategies that right now the attorney has just said in reference to the construction of a pedestrian bridge. And the bridge that also is going to have a lighting a sector in reference to an area of crystal in their initial part. And what is the part here of this whole project to be able to incentivize this part here? This is in a pre-feasibility and that we are waiting to be able to continue together with this to be able to implement this. Okay, well, thank you very much. This is just what I wanted to mention from the city of Monteria, our experiences. This is just a small reflection of this whole effort and this whole commitment that we have as a city with the active mobility and road safety. Thank you very much. We see the passion, and it seems to be quite effective and nice. Okay, and the last one of the examples of this promotion of active mobility here is going to represent by Jesus Carlos Motomofin from the Secretariat of Transportation of Jalisco, Mexico. We were talking about the transformation of pedestrian and cyclist mobilization throughout safe infrastructure in the city of Guadalajara, Mexico. Go ahead. Thank you very much for participating in this seminar and this very specific week of promotion to safe mobility. And if I'm allowed to share my screen, if you can please give me a permit. I think that the previous presenter needs to stop sharing so I can start sharing. Yes. Well, thank you. I give you start seeing some of this context. I'm going to talk about 2 municipalities from the city of Guadalajara and from the city of Zapopan. There are 2 municipalities that are together. They are the largest ones of the municipality of Guadalajara and Jalisco. It's a metropolitan area that has around 5 million people in population, and we have one of the highest rates of mobilization of Latin America, 1.7 persons per vehicle. And while I will begin from the fact that in the year 2007 as a reference, because in this year we actually had an important mobilization of civil society organized in the matter to be able to request a plan that is sustainable in our government. And the context that we were starting from was basically a city designed for cars for since the 40s. We started with this kind of urbanization, a very extensive area due to a bad planning where we would frequently see invasion of curves, as we could basically see this here. And cyclist infrastructure was basically none. But this year, the first cyclist path started in the year 2008. And the design here only thought about for cars without any curves and without any components for infrastructure, pedestrian walk paths, dangerous walk paths where we would have registered the majority of the deaths, and also a lack of knowledge that is seen here by the population in reference to what is sustainable and safe. It is a minority of civil society, the one that began to react in reference to this paradigm and to be able to generate a series of actions and mobilizations that are very important that will be able to be sustained at least throughout 10 continuous years until the year 2015, where the local government of Zapopan and Guadalajara decided to institutionalize the agenda requested by the civil society and to be able to create the first ends of mobility and transportation for both municipalities. How are we able to have this done. First, we had the two directions of mobility created, which gave foot to the creation of municipality regulations, participatory budgets, and specific budgets for the construction of streets and the active mobility. And something that is very important is the financing of these infrastructures as well from these sanctions or fees, as we still call them here, to those drivers that were violating the municipality regulations. For example, for invading the curb, we have elevated costs of 6,000 to 9,000 Mexican pesos for invading a curve. And that budget, our mayors took the decision of being able to see this in mobility of infrastructure for the active mobility. In the year 2022, we were able to obtain our state law. We are in a district of Jalisco where we talk about the most populated municipalities. That has also been very important to be able to generate public policies that are more solid and technical standards that have also had an impact directly in the planning of the rest of the municipality of the state. Three, important access to be able to see this active and regulation and order infrastructure always based on data. Where we require this intervention and the communication of education and culture here in reference to being able to set this. I know we don't have much time, but we are going to continue with this to be able to first talk about the fact that in reference to the problem of vehicle invasion that we have in our cities, we promote a first program which is called Free Curves. Uh, which is what we call here in other regions of the continent. And here, this program it was very important because beside creating sanctions here, we were able to install a course, a special course for people were offered to have from 70-80% of discount in their tickets and if they were able to take a course offered by civil society with different components, accessibility for the people with disabilities and in reference to safe and also our rate of success is enormous. The reincidence that we have on behind of in- infractors is basically less than 50% of those have taken this course. So currently, we are around 6,000 people that have taken these kind of courses in these both municipalities. Additionally to this, in reference to the regulation, in reference to these very important programs, last year we implemented specific controls for the speed in our streets, which is also creating an impact in the reduction of this. And at the end, we will have a statistic of everything that has been seen with these kind of interventions. And this was not done by the municipalities, it was done by the traffic police from the state. And now the municipalities also have these operation capabilities, achievements in infrastructure. In the year 2015, we began with less than 20 kilometers of cyclist infrastructure in the area of Guadalajara. And right now we've been able to build 135 kilometers only in the municipality of Guadalajara, where also by regulation, everything has a cyclist priority in the lanes of the right, 68 stations, public stations for bicycles, which are complemented with the network of Sarapopa of 139 kilometers of cycling paths, 5 kilometers of cycling bands, and 62 stations. With these two municipalities, we are saying that in less than 10 years, we were able to have the consolidation of 260 kilometers of cyclist infrastructure with high components of design, as we can see in this kind of ends. In reference to being able to see this for the space, something that we'd like to actually see here in the metropolitan area of Guadalajara is that when we have a cyclist infrastructure, we're actually recovering the invaded pedestrian structure. The cycle path is to be able to recover curbs, guarantee access for pedestrians, and also to be able to give a safe mobility to cycling people. These components go hand by hand. And also we've generated different lanes. This is a perspective in reference to a kind of campaign that happens in reference to being able to establish this and the physical space, having a via road and to be able to have transportation in a collective manner. We also have these kind of infrastructures in the regulation. We're able to leave here as a base for the regulations of public work. When we're able to design these streets, we would definitely need to have all of these criterias from law, which means it will no longer be something that has to do with willingness from part of the communities. It's about being a requirement that before did not exist. Interventions that are accessible, charge and discharging in reference to being able to see this part of high logistic areas, the rehabilitation of curves with universal access, the placing of the trees to be able to generate microclimates that promote this mobility, cyclist infrastructure, and segregated, right? Not only painted on the street, but it's about having good elements of segregation that actually protect the users of the bicycle. And also the reconfiguration of lanes. We had set here that in Guadalajara, here we have the practice of creating 4-meter lanes in our main streets. And thanks to these widths, we've been able to have reductions to 3 or 2.9 meters, which have actually allowed us to be able to extend these and create cyclist infrastructure in our roads. In our streets here, we have some of the transformations that are substantial to what we have done also with the recomposition of the public space. Here, we're also talking about having an intervention done in an integrated manner, which also includes illumination, which guarantees overall for uh, women pedestrian more safety throughout night, and also with public bus stops and this equipment. Also, something that we've been able to use are the measures of mitigation. The direction of mitigation is have the difficulty of evaluating all of the projects of urbanization of new equipments, public equipments here, and to be able to establish these compensations based on the impacts that we have for these new urbanizations. And here we've also been able to finance new curves, the incorporation of infrastructure, the crossings with universal paths that have allowed us to be able to get to these over 260 kilometers of segregated infrastructure. On the other hand, also projects, as what was already mentioned here by the previous presenter, my colleague from Colombia, that also had a direct impact in citizenship. Here we created um, a program called as Road Boxers. You know, here in Mexico, we have a lot of boxers. We had boxers that went to the schools to talk about road safety through theater plays, not with the perspective of teaching children how to drive safely. No, it's about talking about the rights to the city that they have, to the public space that they have, and that will allow them to become agents, but not making them responsible for road safety, but in future generations that would have a vision not focused on vehicles, but in people in our city. To this program, we also had the bicycle schools that would generate more generations that actually use bicycles. And finally, something that is important here, we have a radiography of the infrastructures that we have, where we are able to see the connections that we have here into what are these green points and these pink points, which are basically people that offer discounts if you arrive with your bicycle, just have a coffee or repair center, such as basic workshops for this. And also there is an infrastructure, a network that is not only public, but it's also private and that promotes the use of bicycles in our city, and that has allowed us to be able to see this part. Just to be able to see, we understand this has not been easy. We've had social manifestations going against this part here. As you can see here, the image, we have a neighbor that because of the construction of this end, one of the main ends of the city, we had this infrastructure given to be able to consider, you know, mobility. But thanks to this end, we've been able to start seeing these kind of visions throughout time, and on the contrary, to be able to get many alliances that today are celebrating the creation of infrastructure for the active mobility. And here we have an image of civil society supporting the creation of a bicycle bus, given the welcoming to public transportation that is arriving with passengers. And this definitely contrasts the evolution that the city has had to start moving every time more and more sustainable. very quickly, I'll just put a little bit of a video, animation of the evolution of infrastructure in the city so that you're able to see what it is that we are talking about. It's not updated, it's only until the year 2021, but we right now have this network build. We have here the bicycles in reference to the public's bicycle system. And here in gray, everything that is projected here to be enabled to be built for the following years. Here we have this parts here in red. These are the ones set in reference to the public part. And here we are able to establish that we are working on the mobility, the active mobility. Now, what is this effort put? In 9 years, there was a reduction of 43% of deaths of pedestrians in the city in Guadalajara and Zapopan, and 77% of reduction in cyclists in Guadalajara and Zapopan. This is a progress that is definitely our pride, but we know it is not enough because here we have a zero vision, which is basically in reference to being able to motivate these kinds of efforts. Here we also had the great challenge to be able to see these efforts, 125 municipalities in reference to this efforts to be able to have this end in Jalisco. But now we are taking here in reference to the general direction and this effort, this perspective, this incorporation of the institutionality to the 125 ends with the objective of getting to a reduction of at least 50% for the year 2030 of deaths for any kind of road sinister that may happen in our state. And in order to be able to get to the second part of the action for road safety. And well, thank you very much for the invitation. And we hope to be able to meet once again, given well best results in reference to this. Thank you very much. Thank you very much. It's been very interesting to have this perspective from the city of Jalisco in Mexico. And we thank you very much for that. And now we have all of the information to be able to have the opportunity of being with us throughout this whole seminar. Thank you very much. We were going to be able to hear the regional perspective of the regional mobility, starting from a vision of Pan American Health Organization, World Health Organization, the very much recent report of this region in reference to how things are. And we will need to see the most interesting tools in reference to the World Health Organization and the experiences and the work from the non-government organizations that showed us this range of possibilities for us to be able to continue working in the same vision. We close with these two government experiences in Colombia and in Mexico. And it is very clear that there is not any independent solution for all of these parts. We understand that we need to continue working in a sectorial manner and where we are able to see all of the citizenship and everything that is observed needs to be corrected, needs to be changed. It's nothing in reference to the policies that how it was discussed, but it's about seeing the policies and the legal standards. It's not just about creating them, but it's also about implementing them, measuring them, improving them, verifying that everything is met in the focus. We should be able to have not only motorized vehicles, we need to work with pedestrians as well. And it's very important in reference to being able to see those that had the intervention to be able to see the regulation framework, laws, policies, regulations. It's very important to be able to have the change implementation, to be able to have the surveillance and sanctioning with the objective of being able to get this expected change. And well, in this and any of the people that are here today, any member of the society that has been the government, Ministry of Health, anyone that has any need of information from the technical point of view, any kind of evidence that can be seen here for our work, If you need the construction in reference to this part, you need to be able to go to your office in OPS in our country, and we will be able to give you all of the support that is necessary. I think it's very important that we are all considering that all of us here together can have these injuries and deaths as a consequence of the incidences being able to be reduced to zero. It's completely preventable, and to be able to see what is feasible. There are still some years that we need to be able to get to the achievements of this part for road safety. And again, we want to thank you very much for your intervention. We see all of the participations in the chat, and it's been a very interesting. We've also been able to share some experiences. All of this is going to be under your disposition under the World Health Organization, Pan American Health Organization, the road safety. Thank you very much to all the presenters. Thank you very much, all of the people that were connected. And we will see you next time. Thank you very much. And let's continue working together. Thank you very much.